It's 8 a.m. from Fox 35. This is Good Day Orlando.
On the Health Watch, more women than ever turning to an alternative way to get pregnant.
While the numbers speak to the success of in vitro fertilization, it shows there's a real need for new procedures. Fox 35's Lauren Johnson explores one woman's struggle with fertility.
That was one of the first things we talked about when we met.
The couple thought they would wait 5 years after getting married to grow their family. Already 28 years old, Nicole Naylor decided time was not on her side.
So we decided to start a little bit sooner.
At 30 years old, she was pregnant and pleased with her new timeline.
But unfortunately, we lost that pregnancy early on. And then the problems started happening.
With so much heartache and pain after a miscarriage, the couple decided to wait a year before they tried again. Still, nothing.
It was very difficult.
So the couple was forced to explore non-natural alternatives like medications and intense specialized treatments until finally deciding on in vitro fertilization.
That's when the frustration and the pain started setting in even deeper.
Truth is, many couples are having the same experience as the Naylors.
The biggest help for me was that we knew another couple going through the exact same thing as we were.
Dr. Christine Greaves with Orlando Health Physician Group says any woman who struggles to get pregnant after a year suffers from infertility. 6 months for women over 35.
A lot of women struggle with infertility.
And the complications increase greatly. Greaves says news of infertility can be emotionally devastating.
As a woman ages, her fertility goes down. The quality of the eggs go down.
That was the case for Nicole. All of her fertility tests came back inconclusive, so the couple had to make a hard decision.
Some women take it personally, some women wonder why. Sometimes we'll never know the reason.
After talking and praying, she and her husband made a decision that would cost them several $1,000s. Not to mention, the process was tedious.
What if we do this and we have another miscarriage?
3 weeks after starting the meds, doctors transplanted 2 fertilized eggs.
For 2 to 3 weeks, I was giving myself injections in my lower abdomen, in my belly.
She waited, and then a call at midnight.
I was just hoping and praying that we would get one baby out of it.
Now, more than halfway through her pregnancy, the procedure worked for the Naylors.
We have twins on the way.
Dr. Mark Trolice, an infertility specialist, is not surprised by a new study saying the number of test tube babies born in the U.S. hit a record high in 2012.
They're realizing that IVF is not necessarily a last resort or a despair option, but really very hopeful.
The report from the Society for Assisted Reproductive Technology cites an increasing age of first-time mothers as a major factor in growing IVF success.
They come to us with a tremendous amount of hope.
Hope for the future and an acceptance.
Some couples are wary of that because of it not happening naturally.
That sometimes a family starts from the outside in. In Orlando, Lauren Johnson, Fox 35 News.
Well, live in our studio this morning, we have Dr. Mark Trolice with the Fertility Care. You're the director there. He joins us live this morning. Thanks for coming in. Good to see you.
My pleasure. Happy St. Patty's Day.
Same to you. You didn't wear green.
This is romantic St. Patrick's Day. Women's health.
Okay. Well, let's talk about this new procedure. You actually brought it to our attention that's out there right now. Talk to us a little bit. Tell us what it is and how it's different from the traditional in vitro.
Well, minimal stimulation and low-dose stimulation, different terms for this, is a way to try to reduce the cost to patients that are going through in vitro fertilization. Now, traditionally, they get injectable medications, stimulate the ovary, make multiple eggs. They get retrieved in an office setting, embryos are formed, and then transferred back inside. This isn't a new procedure. It's been for years that we've been trying to reduce the cost of in vitro fertilization. So less medication, but unfortunately, less eggs retrieved, and the outcome is less successful.
Yeah,
so
less
while
success.
they may pay less money up front for this first cycle, it may increase the cost overall because the success rate is low, so they're going to have to do more cycles.
Yeah, because with traditional in vitro, you kind of just pay a lump sum and then you get a bunch of tries, right? With this one, you pay kind of individually each time you try it?
Well, depending upon the clinic's offering of different cycles and packages, it's usually per cycle. But this type of minimal stimulation could be misleading. And in some way now, it's maybe trying to help with the economy, but it may be also marketing from these clinics. Think about when you go to the grocery store and you get a 2-for-1.
Yeah.
Well, you think that you're paying less, but you're probably paying more at that initial cycle.
Buying more stuff.
Exactly.
Okay, so less medication, less expensive, but the outcome isn't as successful. Is this good for a specific group of women, maybe?
It's being used for the younger women, but that's not the group that you want to do it on, because they're going to respond well no matter what you do. The older reproductive woman who has severe ovarian aging, studies have shown that they actually do just as well with or without aggressive medication. The pregnancy prognosis is poor in that age group, but that's the age group that may just do as well. Minimal stimulation is not what it's touted to be. It reduces the cost to some degree, but they're still paying laboratory and physician fee. It reduces the cost, but reduces the pregnancy rate, and so patients may end up having to actually pay more because their success rates are poor with each cycle. Interesting.
All right, Dr. Mark Trolice, tell people where they can get a hold of you.
Well, our website is www.myfertilitycare.com, and we're the IVF Center.
All right. Thanks for coming in. Appreciate your time.
Anytime.
All right. 8:27 is now time on this Monday. We're back right after this.